Hey guys, Dr. Vassar here. Today we're going to be talking about hip pain, which is something I see all the time in my office, and a lot of times it's going to even be associated with low back pain. So some of the really common types of hip pain that I see is hip pain coming from the low back but kind of across the top of the hip. There's also hip pain right in the middle of the back of the hip, and that can even be associated with sciatica as those muscles can start to pinch on that nerve. And then also in the front of the hip, sometimes with the hip flexor area, and that can also be associated with low back pain. So today we're going to be looking at some of the active release techniques that I can do here in the office to help alleviate some of these issues and get you out of pain, back to doing the things you love, and hopefully avoid some of those more invasive procedures. So we're going to go over 3 of the more common things I see when I'm dealing with people who come in with hip pain. The first one is going to be with somebody that comes in with that pain that's on the kind of low back area, but it radiates across the top of the hip. And that a lot of times is going to involve the glute medius at the top of the hip here. So we're going to have you drop forward and down towards the floor using some active release technique to loosen that muscle up and take some pressure off of the low back and the hip area, and then back towards me. So we'll do a number of passes as whatever the patient needs in that area. And then another common one is the piriformis, which is going to be right in the middle of the hip. This one's really important because you can have pain in the hip, but a lot of times can be involved in sciatic-like pain because the sciatic nerve actually goes right under this muscle. So if this muscle tightens up around that, we can have some of the sciatica down the back of the thigh, maybe even all the way into the big toe area. So I like to check on this anytime somebody comes with that sciatica pain. So drop your leg forward and down, and then turn your leg in and apply that pressure. Good. And then back towards me here. So, and another really common one is in front of the hip pain, a lot of times involving the hip flexor, in particular the psoas muscle, which is through the abdominal area here. So we have to kind of dig a little bit here just to get to the right spot. And so apply the pressure there, and then straighten the leg. I'll brace you here, and then back towards the wall. Good. And that's usually involved with any kind of back pain, so we always like to check that when somebody comes in with just back pain, or of course front of the hip area pain. A lot of tightness can be seen in that area. Thanks for watching, guys. If you'd like more videos like this, please feel free to subscribe to our YouTube channel, Vassar Chiropractic and Rehab, or like us on Facebook for more information. If you or anyone else is having any types of issues like this, please feel free to call the office at 637-1444 to make an appointment. And until then, be well.